Okay, good morning, students. Am I audible?
Yes, ma'am, you're audible.
Okay, fine. Few students are still joining. So today's class, we are not taking up any topic, but it will be a general discussion, and we'll be discussing about COVID-19 coronavirus, how it started, how it progressed in the world and in India, how many people were affected, what were the government guidelines for this, what were the World Health Organization guidelines for the management, and where is today India's position in COVID-19? Is a third wave going to come or not? How much we are vaccinated? What are the other steps taken by the people and the government for managing this disease? So, open discussion where we all will discuss and will know each other's view. That what do we think? I mean, could this pandemic have? I mean, we could prevent this pandemic at the earliest stage pandemic, or the way it's being progressing. Is it due to the virus strains, different strains, the transmission of the virus, or are there some human factors also? Where are our health systems stand? How our health systems were able to manage this disease? What was the mortality and morbidity? Right. So these terms are general open discussion with everyone. I'm still waiting for other students to join. Only 12 have joined. Was there some class going on before this?
No, ma'am, there was
No,
not.
ma'am.
Okay, there was no class. Fine. Let's wait for 2 more minutes and then we can start. So, see, for various guidelines, World Health Organization website, they provide various guidelines to deal with the pandemics like coronavirus. And when we talk about the guidelines in India, there's a National Center for Disease Control, NCDC basically. Then they've given different guidelines. If you visit their website and we check about the coronavirus, so we see a number of the guidelines which are given by them, which tell us that how they have documented this virus in various states. What was the preparedness of the governments and people in the different states? They have a data for that. And then there are guidelines for the disposal of a COVID-19. How do we dispose that? Then the guideline for the quarantine facilities are available on the website. Then roles and responsibility of a rapid response teams in a COVID-19. So those guidelines are there. Then guidelines to be followed on detection of a suspect or confirmed cases. How to do that? Home quarantine guidelines. What are the home quarantine guidelines in case of a COVID-19, right? So all, and when we talk about India, so NCDC is basically the National Center for Disease Control, or formerly it was known as the National Institute of Communicable Disease. It is in Delhi. So they have all kind of a data which is available, whether it's for a COVID-19 or whether it's for any other pathogen or any other disease or any other endemic or epidemic disease which is happening in India. So they maintain a record of these kind of data. So yes, I guess all of us have joined. Only one or two students are remaining. So let's start with how it started. Where were the first cases? Was there any lapses in the information system of the particular country? The information was delayed to other countries. So I'll not take names. You at your own wish, you can just raise your hand, and then I can ask you to switch on your camera, and then we can discuss. Right. So who will tell me about that when it started? Uh, in which country it started and when it was reported, basically. Yes, Devanshi, go on. Switch on your camera and go on.
Good morning, ma'am.
Good morning, Devanshi. Good to see you.
So, coronavirus was first, it was found, the first case was found in Wuhan, China
Yes,
in
right.
December 2019.
Hmm.
And um, that's it.
Okay. Okay, Devanshi, that's you're right. That first case was found in China, and somewhere in December 2019 they reported it. But then there were some reports that some non-published reports which said that that this virus was present much earlier in China. Maybe the Chinese New Year, at that time there were some cases in the patches which were reported, and those cases were not confirmed cases, but yes, there was some kind of an indication of a disease in that particular area. So who will tell me, other person who will tell me about this particular phase, that was there some kind of a lapse in China, or information system, or a public health system, or government in China, that they informed WHO very late? And what was the reason? There were a lot of rumors, right? There were a lot of things coming up. So what were those things, or those rumors that people were talking about? Yes, who will tell me this? Yes, I guess we all know this. There was a lot of news about this. There were a lot of debates about this. No one? Am I audible or not?
Ma'am, you are audible.
Okay, no one knows. So no one knows about this, that why they reported late. Was there any some kind of a lapse? Okay, fine. I'll discuss this. So, it was said that during the Chinese New Year, the Chinese New Year is a festival that they celebrate, and a lot of trade, and a lot of basically lot of uh, lot of markets. Markets are full. People buy things. People sell things. So, it is believed that the cases were much earlier there. Certain reports says the cases in some other part of the countries world also, but in China they say that due to the Chinese New Year they delayed it, because they thought that their their trade will be affected, so they'll get a lot of losses. So due to that also, and another point is that when such kind of a pandemics it takes place, when such kind of a, because it was earlier epidemic there, so when it spread it out, then it was known as a pandemic. So there is some kind of a, still people think that okay, the people will stop trade with our country, people will, and the movement will be stopped, so that in some way will affect the economy of a particular country. So that could be the another reason, but yes, we are still not sure, because these were the reports which were published in bits and bits in various parts, right? This was another case. And the another important this is still not confirmed. I will not say that this is confirmed, but yes, there was another still important, very important point, that they say that some kind of manipulation of the virus. This virus was already there. They were doing some kind of a manipulation was done in the lab, Wuhan lab in China, and maybe by accidentally it got spread and it spilled, or whatever they were thinking. Sometimes what happen, usually working with these kind of viruses, which where the transmission rate is really high, such kinds of a deadly viruses is not allowed. There are certain guideline which every country has to follow, right? But this SARS COVID, right? It 2001 or 2002, it affected few people. So thereafter, people in different part of the world, they started working on this virus. So basically, the thought was there that they might be preparing for the, they wanted to prepare for the possible future pandemic which can be caused by the virus, because scientists somewhere, researchers, they knew that if this virus mutates and new strains are there, so definitely a pandemic like situation can happen. So could be that they were working on that aspect, that if we could develop, we could identify some strains, we could work on those strains, we could develop some vaccines before the pandemic takes place. This is called a preparedness of the pandemics, for the pandemics also. So that was also considered, though this is not verified, but yes, this was also one part, that yes, America or US was one country which was funding this kind of a research in China, because in their own country this kind of a research were not allowed. There are a lot of issues there, so they were doing some collaboration with China. So this was the another factor, that a lot of people thought that it could this could be the reason, that people were already working in that, and accidentally it spread and people got affected. And then since the information to the World Health Organization was very late, because when we are I guess I discussed with you in the starting chapters also, that whenever any kind of epidemic takes place in a particular country, we need to inform the World Health Organization. And by studying the pattern of the disease, we know that how epidemic can be changed into a pandemic like situation. So when these things we observe, we need to immediately inform the World Health Organization, so that World Health Organization, they can inform every country in the world that so and so disease has taken place in this country, so that we can a channelized way of a movement, or if required a movement of a people can be stopped, so that because the people, we as a human were the carrier, right? We were transmitting from one, it was getting transmitted by us, by people, because we were moving to the different countries. People were coming from the China to the other part of the country, so we were the main source of the infection. So that could have been prevented at that stage. So this was the another thing, right? So okay, this was the another point. So can anyone tell me that which was the, when was the first case of coronavirus in India was reported? Any idea? And which state?
Ma'am, wasn't it from Delhi?
Uh, no, it was not
Ma'am,
from
it's from
Delhi.
Kerala.
Yeah, it was from Kerala.
It
First
was
case was reported.
Kerala.
Yeah, it
Yes,
was
ma'am,
Kerala,
in
right?
20
Yeah, it was reported at that time in Kerala, and first case was reported there. And see, the problem was that it was reported in March in Kerala, right? Um, Early March. Holi was somewhere in March. So I remember the time that when it was reported in Kerala, after that, lot of precaution. And 15th March was, I guess, university closed, right? So when it was reported in Kerala, after that, the Indian government, they started taking steps. Holi was not celebrated. People were told that don't celebrate Holi, don't go in a social gatherings. You guys were also coming to the university. So 15, the universities were also closed, and 19th, we all were, I mean, asked to go to home, and lockdown was imposed somewhere in the March, right? So that was the time that it was um but then the problem was that the flights in India, they were closed very late. So movement of the people was still there, and this is why the number of cases they increased. So earlier stages, the when what happens when such kind of a pandemics they come. So we try to locate and identify the first case. That who was the first case. Then you see that with how many people that first case has contacted. Then you go and check those cases also, people also, and basically epidemiologists, they do a public health workers, they do this kind of a work. So they further go and check that how many persons those they have contacted. They try to narrow down, and they try to pinpoint every case, and then put them in a quarantine together, so that they don't spread it further. So this is how at the earlier stages we were trying to manage the disease. People who were coming from the other part of the world, they were quarantined for 18 to 19 days, and then after then only they were allowed, even if they are virus negative, this still a quarantine was imposed. So quarantine plays a very important role in the management or the preventing the spread of the viruses from one places to another, or one people to the other. So this was the another thing, right? Okay, fine. So that was another thing. And then who will tell me the different guidelines given by the government of India for what were the steps taken by government of India for the prevention of the spread of the virus? Or because first step is the prevention, so that we can prevent or we can break. It was very commonly called as we want to break the chain of the virus. So what were the different steps taken by the government of India at that time? Yes, Ishita, go on. Please switch on your camera and go on.
Yeah, ma'am, am I audible?
Yeah, you're audible, Ishita. Yes.
I'm
Yes,
visible.
I can. Yeah, you're visible also. Yes,
Ma'am,
please.
there were different guidelines which were produced. First, the lockdown was imposed. Then,
Yes.
flights were then about regarding the flights. They were
Yeah.
cancelled, and many of them were there. It was banned to travel.
Yes.
Lockdown.
Yes. Right.
Mask was very much compulsory at that moment. Even now also, like
Yeah. Yeah. Now.
there are different penalties if we are not having we are not wearing the mask, using of
Mm-hmm.
sanitizers. maintaining
Yes.
social distancing is one of the main it was basically a main protocol which was given at that.
Being followed. Yeah, right, Ishit. I guess Nehal, you want to add something to this? Please go on.
Ma'am, screening and obligatory isolation.
Yes, this is was very important. Get tested, get yourself tested was very important so
Yes,
that
ma'am. Spreading
yes,
awareness
yes,
by
awareness among the
ads.
people.
Yes, ma'am. By social medias or news and that ringtone we get regarding the corona.
Yeah, that was right. That educating people and making people aware is very important because at the end we need to follow the steps. We need to take the precautions. So lot of advertisement through media, print media, and through the TVs, through the social medias. There was lot of information, a lot of guidelines were given by the government of India also. So as Ishita and Ishita told that yes, the first was the social distancing, wear mask, and first was the lockdown, right? The first thing was the lockdown. So lockdown was imposed in a step by step manner throughout the country. So why was lockdown important? Because lockdown prevent people going outside their houses, right? So they could only go outside only for the necessary things if required. For that also they will wear mask, they will follow a social distancing norms, right? So first thing was the lockdown, which was very important to break the chain of the virus, so that जो जहां है वो वहीं पे रहे, कहीं मूव ना करे. इससे क्या होगा, इन्फेक्शन स्प्रेड नहीं होगा, द वायरस विल नॉट स्प्रेड. So this was the first important thing which was done by the government of India. Second was the um, screening. Screening camps were established in the various societies. A lot of screening of the people was being done so that we can identify the positive, because sometimes the infection was symptomless. So still, but symptomless people also, they are the carrier of the infection and they can transmit the virus. So second was that. Third was the quarantine, if isolation. So if someone is found infected by a virus at home or anywhere, so that person was required to be quarantined. He should be in isolation. If symptoms are not very severe, he or she can quarantine at home also in a separate room. But if symptoms are not very mild, then the hospital requirement is there, so they can go to the hospital also. So a separate COVID wards were being made. A few hospitals were designated as a COVID-19 hospitals only, that they will treat only patients, COVID-19 patients. So, so see, that was the reason that the first wave, the mortality was not that high. Right? First wave, because we all were closed, we all were in the houses, all were taking a lot of care, we were not going out, schools were closed, educational institutes were closed जहाँ पे ज़्यादा crowd होता है. So this was the reason that the mortality was very less during that particular first phase, right? So these were the steps, and then slowly and steadily the international flights were closed, and the flights within the country and other ways of traveling such as rails and other, they were also shut down for a certain period of a time. So everything was closed. Nobody was going out, nobody was moving, everybody was at their home. And this situation lasted, I guess, somewhere in August and September, they started that universities can open with the faculty and research students. Our university also, I guess, is started working somewhere in August and or September. So few people were coming, still the lot of crowd was not there. So this situation lasted for that time, right? So yes, fewer casualties were there, fewer deaths were there. Yeah, people were affected, but they were getting better, and a lot of precautions are being followed. Now the second wave somewhere started, I guess. We were in a good phase around, you can say, the February. Universities were open for the students, teachers also, and for some time the students also. So till April
I'm in
15.
April. In
Yeah,
April.
yeah, April, yeah. So till April 15 or April, we were fine. Things were pretty fine. But then what happened then? Why do you think? Who will tell me that the second wave was more impactful? People were dying. So why do you think? What was the reason for it? Yes, who will tell me?
Ma'am,
I think
Yes,
that it
Yuvraj. Yes.
because of the replication of virus, it has been spread a lot and it
Yeah.
came with a new variant that is the Delta,
Yeah, there was a
right?
new variant. Yes, there was a new variant. And another thing was that the vaccination was pretty much introduced much earlier. But in India, the vaccination process started very late, and that too at the early stages, people they don't wanted to get vaccinated. There were a lot of points we associated that they were thinking that this vaccine will not work. They might get more affected. So people were reluctant, right? So in India, the phase-wise vaccination started with the 75 plus people, and then eventually it came to the 55 plus, and then 45 plus, and then 18 plus, right? So people were not vaccinated. That was one point. Another point was that when lockdown was like relaxed, right? From somewhere I see the November when Diwali was there, and to the March end or April starting. So things were relaxed. Of these some educational institutes were open, the your shopping malls and other things started opening, and then the lot of gathering of the people, it also started happening, right? A lot of festivals were there, so people actually in that time almost forgot that second wave could come, though the epidemiologist had already said that second wave is expected because this is the pattern of the virus: first, second, third. This is how it goes and come back again. But then certain kind of a relaxation was there, and all of a sudden the cases started rising in the April, mid-April onwards. Then in mid-April, again the universities and the schools were never open, but universities were closed again for everyone, employees and students and the staffs also. And this wave was, since the strains were new, people were not vaccinated, and in this second wave, the elderly people who had at least one dose, or some had two doses, they got affected by the pathogen, but still the mortality was not there. Who were the mostly people affected? Younger people, less than the 45 years of the age, because they were neither vaccinated, so they did not had any kind of immunity at that time. So people with the comorbidities such as diabetes or asthma, they were more affected. So second wave particularly affected more unvaccinated group of people. So that was the point when people were not getting hospitals, people were not able to go to the, and then the lot of the saturation level was getting, oxygen saturation level was getting below 90. So people were more panic, and there was a lot of noise about the oxygen shortage. Lot of things were there, and at that time we all were closed in our homes, and we all were worried because there were a lot of messages from our students that their parents are affected, their siblings are affected, or they themselves are affected. A lot of people in the societies are affected, and that people were again inside home, but still the transmission was very high. The people were more and more number of people were affected. Mortality was more. So, but then in the meantime, the best part was that vaccination was going on. So vaccines, two vaccines, Covishield and Covaxin were, they were approved by the government of India to be used in India, and certain other maybe Sputnik also in the later stages. So lot of vaccination was done. Again, they increased their vaccination process so that they can vaccinate more number of the people to reduce the impact of the pathogen. So that was being done, right? So yes, that was the second wave. Then eventually again the infection rate become very low, and now we all are waiting for the third wave. So we are not yet sure because there are new strains again in Maharashtra. The cases are rising again in Kerala. The deaths and cases are again rising. I guess the yesterday or day before yesterday, total cases in India were around 45,000 again, and around 500 deaths were reported from. And the most cases are again from the Maharashtra and the Kerala part, those part of the country. So we still don't know. Yes, if we talk about the vaccination status in India, that what kind of a people are being vaccinated. Total cases, if we talk about in are around 3.27 crore and 4.38 lakh death in India. This is I'm talking about in India, and the highest cases and deaths both are in the Maharashtra alone. They have a lot of deaths and a lot of cases also being reported from there. So if we talk about the spread, that how this virus was spreading, this was through the droplets transmission, that when you sneeze, if infected person he sneezes, so they generate some kind of a droplet particles, and through that it was, then there was a fomite transmission, that this virus was living for a longer time on the objects, also clothes or hard surfaces. So that was again lot of emphasis was given on the sanitization, that and then recently, I guess in April or May, it was said that it was very commonly said that it is spreading through the air also, that in a people are in a closed places in their homes, still they are getting affected. They have not stepped out of their homes for 15 days or 20 days, still they are getting affected by the viruses. So there were certain reports where they say that it could be in the air, but there were certain works which was done by the people, and studies evaluate. There are some studies which yes said that the COVID-19 is present in the air sample, but still published data is not available on this. So there is no published data that it which says. So if we talk about the vaccination systems, so in India around, I mean. 63.3 crore people are vaccinated for a single dose, and both doses are 14.4 crore. So 10.6% of the population is fully vaccinated. So, but 10.6% is very less. So yesterday I was just going through there was some debate going on. Some senior person from he was an epidemiologist, so he was telling that if 50% of our population is vaccinated, still then we have a very less chances that the third wave will be as effective as it was in the second wave. So we need to increase the vaccinations process, because vaccination is the only way by which we can reduce the impact of the pathogen, right? So this was being told by them, and then in the earlier stages they predicted that this third wave will be more affecting the children, because they are the only population that is not being vaccinated. So vaccination trials for the children for the under the age of 18 is still going on, and we are still thinking that by September or October they'll release certain guidelines for the vaccination of the children also. So yes, we all are still working towards it, but then if we talk about who will tell me about the preparedness of the Indian health system, how far it was prepared for such pandemics? What, if not, then what were the drawbacks and what were the things that we need to improve?
Yeah, can you please repeat?
Yes, Yuvraj, बताइए.
Can you please repeat the question?
Okay, I just want to say that, can you just tell me about how much we were prepared for this pandemic? India, especially, I'm talking about our health system basically. If not, then what were the drawbacks, and that we need to fill those gaps? What were the gaps, and how we can fill those gaps for the preparedness of a next pandemic if it takes place?
Ma'am, an appropriate setup of an oxygen, that will be the first thing. And with this, we should do some uh, appropriate labs of genome sequencing, as well as we should regularly perform serological surveys, so that we can identify the antibodies developed in the people, and we need to take the precautions as well.
Yes, okay. You just told me that what steps we need to take, how we can do serological surveys, and there should be proper genome sequencing labs. A lot of this work was done in India, Yuvraj, NIV Pune, and CDC, and various other. If we last year we see the proportion of the paper being published, you'll see the 50% of the publications were on a COVID-19, either in the review forms or certain reports in a smaller reports, or a proper research articles where they have done a lot of work on the this virus. So basically, I wanted to ask about the hospital. Yes, you told about the oxygen level, oxygen scarcity. Basically, see what happens. Oxygen is required in a smaller amount, and usually every hospital, private hospital I see, they have a smaller oxygen plants available in their premises. So usually that requirement is met. But when all of a sudden this kind of a requirement increases, then yes, some sort of a preparedness is required, that if all of a sudden there's a requirement, then how we can provide the proper oxygen. And there were some problems which were associated with the oxygens, right? Some side effects also. Number of cases of a white fungus were reported due to the oxygen. See what happens. Oxygen, to generate oxygen also, you need a clean water or a proper water system. You cannot just use any water for that. Then the pipes of the oxygen through which it goes through the airways, nasal airways, so those should be very clean. So within a period of a time, because there's a lot of moist and humidity, a fungus, it definitely, whenever there's a humidity, there's a lot of moisture, fungus will come and get deposited. So what happened at that time, it could be due to the bad water being used, it could be due to the bad sanitation practices, it could be due to the dirty pipes which are being used for the this oxygen delivery to the people. So there were many reasons for that, right? So we need to take care of these things also, that in what way or in what see, they said oxygen, when it is generated for use in the industrial purposes, is a different than the oxygen which we generate for the human purposes. Definitely a lot of sanitation and a lot of sterilization is required. Practices are being required to be very clean as compared when it is required in the industrial purposes. So that difference we need to make. We need to be very careful when we are giving these things to the people. So that is one thing. Another thing is the increase in the healthcare facilities. See what happened at one point of a time, hospitals were full. Yes, I agree, the situation was worse. The number of people getting affected were more, but still some sort of a what happened in China, they immediately created a facility, a temporary facility for the treatment of the COVID patients. So such kind of a things and such kind of a facilities should be available in every country, that if required, they can build such facilities in a short period of a time, rather than making people running from one place to another. So that means a lot of funds, sparing a lot of funds for the health purposes or health systems is very important. Second important thing was the lack of PPE kits. So that was really bad, because you're not providing proper kits to the personal protective equipment to the doctors. Then how can they treat such highly transmitted viruses? So that is also another thing, that we should be prepared for such kind of a kits for treatment, for dealing with any kind of a pandemic or pathogenic viruses or other pathogenic organisms. So that is another important thing, that it's not that at last moment you go and ask for other countries to send us the things, and no, it should be already available. So we need to take care of the doctors also who are treating these kind of a patients. So this is also very important. Then the vaccination, yes, still some people were not very happy with the vaccination. There was some kind of a rumors going on. It was very difficult to make these people understand that no, vaccination is the only thing. Number of the people, they died in the villages of India, maybe in the UP or other parts, and they were all not even reported, they were not even documented. So this situation was very worse and very pitiful when you see in the news, and you see there are a lot of pyres burning near the rivers. You see a lot of dead bodies in the Ganga or other rivers are being just thrown like that. So those were very pitiful things, and they were scary also. And they were somewhere एक जो होता है ना कॉन्फिडेंस, बाकी लोगों का जो हेल्दी है घर पे बैठे हैं, that was they were losing out their confidence, that what if they got infected. So those things we need to take care. And then preparedness for the pandemic, any pandemic for any country, is very important, that how efficiently you can deal with the pandemic. So those things, how efficiently you can impose the conditions. अगर ये जो लॉकडाउन कंडीशंस थी स्टार्टिंग में इम्पोज हो जाती, जब फर्स्ट या सेकंड केस हुआ था, एटलीस्ट इन दैट पर्टिकुलर स्टेट, केरला को पूरा आप वो कर देते, क्वारंटाइन कर देते, इसको पूरा कंटेन कर देते उस स्टेट को, तो थिंग्स वुड हैव बीन बेटर. आप अपने एयरपोर्ट की क्वारंटाइन फैसिलिटीज को स्ट्रॉन्ग बनाना इज वेरी इंपॉर्टेंट, so that movement, or total ban, you just impose a total ban that people will not be allowed, only few flights, and they'll be also quarantined. So government actually need to take a lot of steps and a lot of actions. Yes, these actions will again they have some kind of a negative impact on the people, because in today's world, a movement of a people from one part of the country to other part of the country, whether for education, whether for a trade, whether for a job, it is very common, right? So we cannot all of a sudden stop these things, but then lot of precautions and lot of guidelines should be followed, that if allowed, then how careful we are for allowing them, how we are testing them at airport, how strong is our testing system. So those things are very important for the management of any epidemic or a pandemic like situation. So this is again a very important point, right? So we know viruses, they evolve very fast. So definitely now and then we are expecting new strains everywhere. So now recently there was a statement by Dr. Swaminathan, who is working in a WHO also, right? So she said that this could be endemic, like in a long run, if we think about the virus, it could be endemic. Yes, it will stay there with the people will get infected by it like a normal flu, but then it will not cause mortality so much as it is causing right now. So we still do not know the path of progression of the pathogen. We are still skeptical about the vaccination. Yes, vaccination people are getting, but how useful they are, it will tell us in a very long run only. Right now nothing can be said. So a proper vaccine is yet to come, which is being tested and assured, and which can be then given at different intervals to the different population of a people or a group of a people. So we are still somewhere in midway, and we are still with the corona. We all are living with corona, so we still need to be very careful. We need to wear mask, social distancing norms should be followed. Vaccination is required, very important. Avoid going in public places as far as possible. So these are the only small things that can make us we can be safe from the pathogen or a virus. Or in case if you get infected, get checked, get tested, isolate yourself, don't go and sit with a group or a group of people, don't transmit, don't be a source of a transmission at least. So those small steps can be taken, and it can definitely help us to prevent the spread of the pathogen, right? So COVID-19, we are still going through. I guess the next week they are thinking of opening the universities. So if at all it opens, then again we should be all be very careful that we don't sit in a gathering. We try to be social, not to socialize as far as possible, right? So all those things are required to be done. And I don't know if any one of you have heard a news. There's recently a new viral infection which is being found in the states, different districts of a UP. Can anyone tell me? I guess it was 2-3 bags a news came.
Viral fever.
Yeah, it's a viral fever. They still don't know the cause, but this fever is earlier symptoms are similar to the coronavirus. Then people are getting tested, but no coronavirus is being found. They are negative. It is elongated. Otherwise, viral fever lasts for 2, 3, or 5, 6 days. Though this lasts for 12 or more than that. And the negative point is that it is causing mortality in children. So number of children they have died. The platelet count of the children, it is dropping suddenly due to the viral fever. So again, it is being transmitted maybe through the human contact or through the contact only. We don't know yet much about this virus, but then again we need to be very careful. It is not, yes, mortalities are more in children, but it is affecting the adults also. So again we need to be very careful. A virus is still going on and another virus is again coming up. So we need to be very careful. You also be very careful when you go out. So please, if there is if minor sign of the viral or a virus or a flu like symptom, get it tested. Don't just sit at home. Get it tested for coronavirus also, and for the other viral fever also if it is there. So some kind of a treatment, because it is lowering the platelet count. So that means if such kind of a intervention by the doctor is required, so that can be done. Because these days viral is common, right? When a season changes, we know viral happens. When it's why we always think that it is a normal flu or a common cold or common flu. So definitely we don't even think of going to the doctor. But then we need to be careful. We need to see if it is more than 2-3 days it is lasting, then we need to go and see the doctor and get our platelet count checked, if to see whether we are not affected by the particular virus. So this is very important, right? So this was about the coronavirus pandemic that we are still facing, and let's really hope that yes, it ends soon. It does not last another year, because this is the second year we are going through, and a lot of time has been we have lost due to this. Lot of classes, lot of face-to-face classes, lot of competitive exams postpones, lot of things, lot of problems basically, right? So it seems sometimes like 2 years or 1.5 year of everyone's life is like nothing. You're sitting at home, yes, you're taking classes, you're doing, but still it is not that as it should be, right? So yes, let's really hope that it goes out very soon. And still, yesterday's news was again in US also the cases are increasing coronavirus. So let's see. I mean, how it is progressing in this particular wave, how people are affected. So it's we should not be relaxed if we are vaccinated, or yes, that we are vaccinated. It cannot happen now. No, it can happen. It can affect us. So we should be as careful as we were last year or as we were during the second wave. So that I mean we prevent this infection to happen or spread or in any ways affect more number of people. So this is very important, right? So this was a general discussion I wanted to have about the coronavirus. In between the modules, or we can keep such kind of a general discussion where we can talk on any topic which is general, and we can keep our views on that, right? So that's all from my side. Please switch on your cameras for the attendance. Adhish Mishra. Adhish Mishra, am I audible? Ayushi Jain.
Present, ma'am.
Sam.
Present, ma'am.
Devanshi.
Present, ma'am.
Ishita.
Present, ma'am.
Janvi.
Present, ma'am.
जानवी के बाद कौन है? क्षितिज.
Present, ma'am.
मानसवनी.
Present, ma'am.
नम्रता.
Present, ma'am.
नंदिनी. नंदिनी राज. नेहल.
Present, ma'am.
नेहल के बाद कौन है? रूपल.
Present, ma'am.
साहिबा.
Present, ma'am.
स्वर्ण. संजना शर्मा.
Present, ma'am.
शक्ति भदौरिया.
Present, ma'am.
शिवानी मिश्रा.
Present, ma'am.
तन्वी शर्मा.
Present, ma'am.
तन्वी के बाद है त्रिदिव चक्रवर्ती. त्रिदिव.
Present, ma'am.
विवेक. युक्ता. युवराज.
Present, ma'am.
Present, ma'am.
Okay, so yes, all are present, I guess, right? Okay, so for practicals, I hope you all have, or you all are submitting your practicals, because Thursday we have a practical class. So before that, please all of you submit your 2 practicals that we have done. So just make one PDF for 2 practicals. Otherwise, there will be a lot of PDF files will be there. So your name and the Viro practical you can write on that, right? So submit those practicals before the next practical class. So I'll see you on Thursday now. Okay, thank you, Bacho.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Okay, okay.